Hello, I'm Kendall Jameson Gilmore. I'm going to talk about the key findings from my thesis, for which I was recently awarded a PhD in management from the Escuela Superior Santana as a HealthPros Fellow. And I focused on the role of managerial systems in promoting higher value care. So first of all, just to consider why is this relevant to other settings? Well, internationally, there's growing expenditure in health systems, increasing resource needs, and concern about unwarranted variations in access to and outcomes from care. So as a result, there's much interest in tackling poor value in health. And a key part of doing that is to measure the value provided by healthcare investment. We know, though, that measures of performance based on volumes of activity or specific clinical markers are not good at measuring value in a meaningful way for patients. So to do that, we look instead at the patient voice. And we know that PREMs and PROMs, patient-reported experience measures and patient-reported outcome measures, can provide a helpful way to do this. They're widely available, validated surveys. So I consider my findings around this value creation cycle which I proposed, where the key is that if you collect a meaningful measure in the right way and treat it in the right way through this cycle of data use, it can be relevant for patients, subpopulations, and whole populations, and can be used to inform actions at the level of professionals, organizations, and networks. So I look at this cycle through 5 research questions, research papers I'll talk about here. So the key lesson from paper 1, thinking about all the ways in which PREMs are used, is that policymakers and managers should consider carefully the kind of PREM programs that the kind of patient experience programs that they're driving, and focus on those which are most likely to be effective, because most programs are not evaluated and the most are at the micro level. Next, thinking around how you can look at PREM data between countries, we can see that it's feasible to benchmark and compare performance between countries, and therefore that managers and professionals in one country can learn from programs in other countries through benchmarking. Next, we consider about how you can collect PREMs and PROMs. You can see that integrated collection of PREMs and PROMs together can provide meaningful performance information for different levels in health systems, from the level of professionals in the community through to hospitals and health systems, but also that the timing and mode of recruitment for people into these surveys matter for their participation and the levels of attrition. Next, we can see that there are no neutral presentation options, so it's important to consider how data are presented to the end user. There are no neutral presentation options, so the decisions that are made in their presentation will affect people's understanding and therefore the actions that they will take as a result. It's important to have a thoughtful approach to presenting this data. And finally, looking at the context of the COVID pandemic, we can see that patient-reported experience measures can be used as a mechanism to provide feedback to health professionals in a time when they would otherwise be unavailable to see traditional forms of patient feedback, as a way to support staff resilience. Thank you.